that we should do everything in our power to make life as easy as it is for people. And I think there's a lot of merit to that. But at the same time, life is hard, right? And it's a lot of personal responsibility.
Oh yeah.
And I'm not saying like everyone can, remove themselves or like bootstrap themselves from a terrible situation. That's not what I'm saying. But like for me personally, I recognize I can't rely on the government for really anything, right? Like healthcare in Canada and in the US is broken. Okay. In Canada, like I tore a ligament in my leg.
Oh.
So it's starting to heal now, bro. Which is good. But waiting on an MRI for over a month now.
It's gonna heal before you get the MRI.
100%. And if it heals bad, I'm screwed.
Yeah, I don't know. Like again, speaking of comparing stuff with back in Iran, I'm sure you've heard this already, but things are way different in Iran. Like healthcare system is totally different. You almost don't pay for medicine.
Mm-hmm.
You don't pay much for doctors. It's very, very cheap. And you can get appointment from super end of the specialist a week from today, whenever you call them.
Mm-hmm.
From a generic, like I don't know, like a family doctor to any specialist, to the best specialist in town.
Mm-hmm.
The latest that you can get an appointment is a month for that specialist, but for a doctor you just want to visit, you can go and walk in, you get the appointment like in an hour.
And what's the quality of care?
It is great. My father was diagnosed with cancer, and he did the surgery, he did everything, $0
Mm-hmm.
and zero Persian dollars.
and how long did he have to wait?
Nothing.
No time.
No time. So he visited his doctor, let's say the first week.
Family doctor.
We don't have family doctors
Okay.
back in Iran in a term that we have here. You go to a doctor that you
like a clinic.
Yeah, there are doctors. You can go to any of them you want.
Mm-hmm.
You can visit as many as you want.
Sure.
They all visit you. They don't say you're not my patient.
Mm-hmm.
And they give you their diagnosis. They say you need to go to a specialist. You can also go to the specialist directly.
Okay.
You don't need anyone to refer you.
You don't need a referral, yeah.
No.
Dude, here referrals take forever. Another story. This is true. Is I had a stomach infection for years. And I didn't know what was going on. And so when I say years, I had it even in the U.S. Like, and I've been in Canada for 3 years, right? Yeah. So I got a family doctor here, told him I was having all this pain and stuff. He's like, okay, we're going to recommend you to what's it called? A stomach specialist, right? I waited, bro, 2 years. 2 years.
Oh, shit.
In the meantime, I see a naturopath, right? And they found out I have a SIBO infection. Okay. And so I'm getting medicated for this. And then 2 years later, this guy calls me and he's like, hi, I'm sorry. You know, he did the Canadian story. I'm sorry, but we're just getting to you. And his first question was, so are you still having problems? Because he recognized 2 years. And I was like, I already got help, bro. Thanks.
No, it's unbelievable, to be honest. I don't get it. Like, I don't know what I prefer. I don't know if it is good if we say pay or like, I don't know what's the best solution.
Yeah.
I'm not an expert there, but I think if I had the option to pay to visit a doctor, also have whatever that it is right now, could be something that is better. Like if it's emergency and we don't have enough doctors, I want to pay or do something about it to take care of myself or my family. So I don't know what is going on with the healthcare system here. I don't get it, to be honest.
I agree. And because I've experienced both healthcare systems. I've experienced it in Canada and in the US. So one nice thing about the US is you can be seen very quickly. Like if you have a family doctor, you know, like I used to call my family doctor up and like I could see him same day. You get recommended to a specialist. I can see the specialist, you know, within, you know, a week, maybe two, you know.
Dude, that's what I want.
If it's busy, maybe a month. But you have to have good insurance for that, right? Like they'll accept your money if you pay. So one benefit to the American system is if you have money, you will get seen and you can get some of the best healthcare in the world if you have money. But there's a lot of people that don't have money and they don't get healthcare, and that's broken. Another thing that's broken in the U.S. is it's more, I would call it symptom-based treatment. And I haven't had enough problems in Canada to know, but I feel like this problem's very similar in like Western medicine is rather than focus on getting you healthy, they focus on, oh, you're having a stomach problem, take this pill. Oh, you know, or we'll do this surgery and we'll remove your gallbladder because I had that done too. And rather than being like, maybe let's figure out what's causing your issues, like, okay, like what's your diet like, you know, like all this diabetes problems. Like, I don't know.
Yeah, it's crazy for sure. I don't know. Like, I think at least in Canada, you should be able to pay to get the right help. That's the least that should happen. More should happen, but that's the least that should happen. For my friends who want to come here to Canada, they ask me like, what is not good, what is good there? And the only two things that I say that I don't like it here is the first, healthcare system. And the second is losing friends. Is to be honest, losing friends
You
is
mean
a bigger hit.
friends in Iran?
Yeah.
Yeah,
Losing friends and family is a bigger hit than what people think. They think it's just family, but losing friends and family.
Oh, that's tough.
It is tougher than what people think when they want to do it, like any immigration or moving at least from Iran to here. But yeah, healthcare system is the worst thing here. I cannot think of anything worse than this.
Yeah, I agree. Like, I know for myself, I walk in and I have very little trust. I have a lot of distrust in the medical professionals. I also did in the US too, based on what I described before. But like, I just, at least one thing I saw in the US was like, if like they have some of the best doctors in the world, you know, like if they figure out what's really going on, like you can get the best treatment in the world. You know, you go to Cleveland Clinic, you get some of the best treatment you can get in the whole world. And people come from all over the world. People come from all over the world to get treated in the US. That doesn't happen in Canada. You know,
That's
like
a sign, I guess.
You know, like, yeah. What, like, do you hear many stories about people being like, hey, like, I flew from Africa to get, you know, my heart surgery in Canada? No. But you hear that in the US all the time.
Yeah. I guess US is more inclusive when it comes to healthcare system than Canada.
It's inclusive as far as the dollar. If you have the almighty dollar, you'll get seen.
Yeah.
And in Canada, it's inclusive as in everyone gets it, but we all get the same shit.
Yeah.